clear because it has no perfusion, yeah? And this is, it has a tumor, yeah? And what is the tumor? This is something which is enhancing, but in different manner compared with the kidney. And we also see that this is a disease, a lesion, yeah? Both things are good, yeah? When something is enhancing and something is non-enhancing, we just are looking for a difference between norm and pathology, yeah? Between the tissue which they derived from and the disease. So both are good, yeah? And another important thing and another helpful thing is that looking at the pattern, at the way of enhancing or non-enhancing, we can think about diseases and we can make guesses what is the disease, yeah? So is non-enhancing, completely non-enhancing. That means it has no perfusion, no vessels, and if we take into account that it's like a round structure, yeah, with homogeneous content, which is like medium grade color, so this is something with fluid, yeah. And if it's round and in the kidney, it's most likely either cyst, yeah, held the fluid. So it was gray and right now it's white because can you explain why it is white right now?
Because it has
we
blood.
administrate iodine, contrast media inside the vessels, and this is a big vessel, and it will definitely have some contrast media and more than surrounding tissues, and so that is why it is white. So after contrast enhancement, big vessels are white, especially aorta, and sometimes even smaller vessels. Yeah, if you compare this line, these white dots, these lines, these are also vessels, but smaller ones. So the first sign to keep in mind and to understand that this is a contrast enhanced picture, yeah, to look at the vessel. So this is really good. And in the pelvis, what can help? You can also look for vessels, and for example, yeah, vessels look like these white dots, yeah, but they're small vessels, not like aorta, so they were not so clear. And another thing that could be helpful, that could be the situation, yeah, if you compare this brain and that brain, could you see this effect of turning the light on, that they are more different in color? Yeah, and what does that mean? That means, yeah, that we can see white matter and gray matter in different shades because, yeah, like gray matter, these are tissue with more vessels, yeah, because these are like neurocells, yeah, and white matter is fibers, yeah, and there is less vessels, yeah, and so that's why, yeah, we can see the difference between white and gray matter in bigger detail. In recognizing the lesion, can you see it more clear? It's here, yes. And if you look at this pair of pictures, it's more bright there. And even here, and if you compare this pair of pictures, where do they see it in bigger detail? There. And again, where? Yeah, and the same the thing that there. Yeah, every time when we compare in a pair of picture without contrast and with contrast, yeah, it works. Yeah, we see it in better detail. So this thing, is it getting whiter? Can they say that this is whiter? No, it's not getting whiter. So it doesn't have vessels. Yeah, it's again cyst filled with fluid, but in the brain. Yeah,
it is not enhanced.
Filled with the fluid, but in the brain. Yeah, so this is a cyst. This is non-vessel thing.
Then what about the brain soft tissue, like soft tissue in the brain? It is also non-enhanced.
It depends on what kind of soft tissue. Like cyst filled with fluid is soft tissue. It's non-enhancing because it doesn't have vessel. But if it's a tumor, it has vessels and it's enhancing. So all other pictures shows the situation when we see something which is whiter, yeah? In a circle, yeah?
What about the cavity filled with pus?
Yeah, I'll show you right now. Okay, yeah? So let's figure out, yeah? So what is the effect, yeah? This lesion is getting a little bit whiter, yeah? And this lesion is homogeneously whiter. And compared with that lesion, yeah, it's getting more white in comparison. And is it homogeneous? No, yeah.
No, it is
so
not.
The pattern of enhancement is inhomogeneous. So this is basically how benign tumors do. So they are enhancing in a small degree in a homogeneous manner. And this is how basically, yeah, malignant tumors do. So they are enhancing usually in a bigger degree and in only homogeneous manner. So if we return to this thing, yeah, again, this is, yeah, enhancing in inhomogeneous manner. What are your guesses?
Enhancing.
Malignant tumor.
Malignant, yes,
tumor.
malignant
They
tumor.
have different histology. In this situation, this is meningiomas. These tumors, they are meningiomas. Benign meningioma, malignant meningioma, and this tumor is glioblastoma, another type of tumor.
Okay,
So from
these are
other
also
tissues,
enhanced.
They are both enhancing because they are tissues with vessels, with different amount and quality of vessels. And if we look at that picture, what do we see there? We see this contrast enhancement in a ring style, in a ring style. So what does that mean? That this is something which has something which is not enhancing in the middle, in the center, and only the circle around is enhancing. And it's really typical for abscesses because there is pus inside, necrosis, and this ring around. So this is how it works. So this is usually like abscesses looks like at our pictures.
It is like enhancing.
Only the circle around the inflammation part is enhancing, and the pus part, which is like fluid,
is
it's
not
enhancing. It's not enhancing.
So if it like if somebody like abscess, so abscess is enhancing.
They are partly enhancing. They are enhancing in a ring style. Actually, mostly metastases do it in the same manner because many metastases they like to be necrotized in the center, and so in this situation, these are breast cancer metastases. We see them in the same manner. So these are white circles, like looks like small abscesses, but there are many of them, and they are more close to cortex, and which is more typical, for being metastases, from some tumors. And these are also metastases, but from another types of tumor. They are also enhancing, they are really enhancing in a big degree, like this. And they are doing it not in a circle manner because they are metastases of different tumors. They are not with necrosis in the center. So this is how it works. So again we see the examples, that which helps us to pay attention to the lesion and to make guesses about what it is. Guesses, not like we are not sure for 100% because it works on big numbers, and if we analyze like thousands of people, it works. But in some people, some tumors can be special, so sometimes it doesn't work in the same manner. So we're just making suggestions, we're making recommendations, but we are not usually 100%. But we are helping, what to look further on, So pay attention to this. And what is also important, let's pay attention, that basically we like enhancing images and we like enhanced pictures, because they're helpful, and they are like turning the light on. But in some situations, they are not the right choice. For example, if you look at these two pictures, basically at first you say, okay, this is also something which is enhancing, But these are situations which are completely different. These are pictures without enhancement. These are non-contrast enhanced pictures. And the reason we see lesions in white color is because they are really dense. Not collecting, not like enhancing, but they are just dense. These are hemorrhages. These are clots. They have like kind of 90 Hounsfield units of density. This is epidural hematoma and this is intracerebral hemorrhage. And they are white because they are dense. And in this situation, we are not supposed to do this contrast enhancement thing. So not to mix them up. So pay attention to this. This is important. Look how nice contrast enhancement works in looking at the gastrointestinal tract. In this situation, we can see the bowel wall in a really nice white manner, And if it's alive, it has vessels, we see this white wall, and these are bowel loops with ischemia, and they're not enhancing, They are just gray, no this nice white thing, And if you look at the bone with inflammation, it's the same interesting thing, So this is normal bowel, They are normal intestines. They are just white thin wall, and these are inflammation, And in this situation, we see thick bowel, and it's enhancing, So ischemia looks like this, And inflammation in bowel looks like this, So this is really different, and we can recognize this, And since this is computer thing, 120, and this is a big difference, it's almost 90 Hounsfield units, and on the language of CT specialist, this is highly suspicious of really malignant tumor, and especially in the lungs, it's highly suspicious. We can use contrast media in many different manners. What's this?
Bone, femur.
Yeah, it's CT arthrography. Yeah, we are looking for a joint. And again, we
leakage.
see leaking. Yeah, because the capsule, joint capsule is broken. Yeah. Have any guesses? What's this?
Vertebra.
These are fistulas. These are fistulas, which are between colon and skin. Yeah? And since these are tubes created by disease, the best idea to look at them is filling this tube. Yeah? So this is what so this is like the same thing like we do in traditional X-ray. So next thing is kind of borrowed from traditional X-ray, but a little bit adjusted, adopted. Yeah, and it has official name like topographic labeling, but usually in practice it's named like oral contrasting or rectal contrasting. So that means we are contrasting gastrointestinal tract, but for different purposes compared with traditional X-ray. In traditional X-ray, we are contrasting gastrointestinal tract to look at this tube, yeah, and to study it using contrast media. It will be like brightly white, yeah, and we can differ it from surrounding tissue. On this picture, yeah, the intestines are brightly white, yeah, and so that's why we can differ from surrounding tissues. In this picture, the rectum, yeah, is bright. The rectum is bright, yeah, and so this is again, yeah, the way to differ it from surrounding tissue, yeah. So this is really helpful, allow us to skip from this invasive traditional X-ray procedure, yeah, in which we have to administer the contrast media intraarterially, yeah, and this is invasive procedure, and we, yeah, when this bolus of contrast will be here, and in this moment we'll collect the information, yeah, collect data, and after that we'll perform, yeah, specialized computer reconstruction, yeah. So sometimes